Very well. Let's talk about autoimmune diseases and the approach from acupuncture. What is the definition of autoimmune diseases according to the National Institute of Health? Because to address them, we need to explain a little about what they are, although I am sure that everyone knows what it is about. It is a condition in which the body's immune system attacks its own healthy tissues because it confuses them with foreign tissues. We have a defense system that protects us from foreign tissues or foreign products or immune substances that are attacking us or allergenic substances. And suddenly our body makes a mistake and somehow attacks some of our own tissues. Most autoimmune diseases cause inflammation that affects many parts of the body because the body itself, when attacked, becomes inflamed to defend itself. It would be like a bit of an imbalance in which an attack that is not external, but internal, produces inflammation, which you know is one of the topics we have been discussing more in depth lately about acute inflammation, but also low-grade inflammation. These parts that are attacked can vary depending on the type of autoimmune disease in question, and the symptoms are often intermittent, appearing and disappearing, and can be mild or intense. It may be that a person during a certain time, a season of the year, does not have much tendency to have this autoimmune disease and instead does have it in another season, or for example, when they are more stressed, they are more affected by this disease, and when they are calmer, less so. We will also talk about this. In general, autoimmune diseases are also more common in women, and the reason is not well understood. They can appear in various family members, which is why we sometimes think there is a genetic component that makes them more prevalent in some families than in others. What are the general signs and symptoms of autoimmune diseases? They often coexist with fever, muscle pain, pain and swelling in the joints. There may be skin problems, abdominal pain, digestive issues, fatigue, as well as respiratory problems, and even inflammation of the glands in the adenoid areas. All of these can be signs and symptoms that may lead us to think, if we do not see another cause, that the underlying problem in this patient is one of autoimmune characteristics. They are also characterized by a rather harsh reality. We still do not know what the cause is. We know that there is inflammation. We know that there is an effect of the body against itself. But we do not know what the primary cause of this problem is. Researchers are still considering what this cause is, and there are several hypotheses. There is a genetic hypothesis. There are hypotheses regarding diet, and hypotheses about what can happen after repeated infections. In fact, it has been observed that after COVID or even after many other viral diseases, these autoimmune diseases may appear more frequently. Another hypothesis would be exposure to chemical substances and even environmental pollution. The hypothesis is as open as this, and perhaps it is not a single cause, but rather several causes that irritate the body and make it rebel against itself in a kind of error while trying to defend itself. The pathophysiology of autoimmune diseases is what I have told you, that the immune system confuses healthy parts of the body with an attacking substance, and this process causes the symptoms of an autoimmune disease and occurs much more. It is also not known what the reason is in women compared to men. Here I have provided a long list for you to see examples of systemic autoimmune diseases. You can see that there is a very long list, from lupus erythematosus, rheumatoid arthritis, Sjögren's syndrome, which is the syndrome that causes dryness, connective tissue problems like scleroderma, myopathies, polyarthritis, problems of arteritis, nodular panarteritis, even ulcerative colitis or granulomatosis. That is to say, there are many diseases that we could list many more, but if we go by systems, we can say that, for example, in the digestive system, we can find autoimmune diseases such as hepatitis, unknown cause hepatitis, which are autoimmune hepatitis, or pancreatitis, or problems like achalasia, or eosinophilic esophagitis, autoimmune cholangitis, celiac diseases. Even in the musculoskeletal system, we often find psoriatic arthritis, an arthritis that first affects the skin dermatologically, but then affects the joints, or palindromic rheumatism, or reactive arthritis. It has even been said that fibromyalgia or even chronic fatigue syndromes may be related to an autoimmune disease. We also find in the heart problems such as myocarditis or congenital heart block or giant cell myocarditis or post-myocardial infarction syndrome, which appears after a heart attack as an autoimmune disease. And regarding endocrine issues, we also see type 1 diabetes or Addison's disease, which affects the adrenal glands, or Graves' disease, which affects the thyroid, or Hashimoto's thyroiditis, for which many women today have hypothyroidism due to this thyroiditis, in which the body attacks its own thyroid cells, resulting in a state of hypothyroidism. There are also polyglandular syndromes, or in respiratory problems, there can be fibrosing alveolitis, where the lung becomes fibrotic due to this inflammation. In dermatological diseases, we can find many types of skin diseases that are classified as autoimmune, such as pemphigus urticaria, alopecia areata, lichen, erythema nodosum, eosinophilic fasciitis, collagen-related syndromes like sclerodermiform syndromes, morphea, and angioedema. And also regarding hematological diseases of unknown cause that are classified as autoimmune, we can find thrombocytopenic purpura, immune neutropenia, hemolytic anemia in which the body loses red blood cells without knowing the reason, Evans syndrome, pure red cell aplasia, pernicious anemia, and many diseases of unknown cause are also classified as autoimmune. Also in the nephrological system, there can be nephropathy, interstitial cystitis, glomerulonephritis, and in the sexual organs, there can also be orchitis or oophorytis. In women, there are often cases where women have frequent miscarriages without knowing the cause. And in the end, they are diagnosed with autoimmune disease. In fact, one of the treatments that are most commonly used for frequent miscarriages lately are medications that decrease immunity so that the body does not have these frequent miscarriages. And since this effect is likely unknown or experienced as something unknown, it is eliminated. And also, in others, we can find autoimmune diseases of the inner ear. In some cases, Meniere's disease has been classified as an autoimmune disease, which, as you know, presents with dizziness. We also find neurological diseases and ophthalmological diseases, uveitis, retinopathies, optic neuritis, Guillain-Barré syndrome, and even multiple sclerosis is thought to probably be an autoimmune disease. Therefore, as you can see, we have a wide variety of pathologies for which we do not know the cause, and normally the treatment is a maintenance treatment. They are not curative treatments, and the aim is to reduce the immune system's action against the person or the patient themselves. Thus, immunotherapy treatments or even cortisone treatments are used frequently. But if we enter the area of Chinese medicine, there is one author whom I like the most and who explained Chinese medicine the most, which is Giovanni Macchioccia. And he says that the origin of the disharmonies of the defensive system is deeper than other pathologies. Therefore, we could already think of it as a very deep pathology because it is very strange for the body to attack itself. Thus, it is a pathology that penetrates deeply into the patient. The onset of the pathogenic factor in autoimmune diseases is more insidious, and the Chinese expression would be that the body is on the lookout, as if you are always trying to defend yourself. According to Chinese medicine, we have a defensive system that protects us from the outside, and it also defends us from certain emotions. It is always on the lookout, but not all the time. In contrast, in autoimmune diseases, the body is always on the lookout, always prepared to attack, and it does so even when it is not necessary. This would be the explanation for autoimmune diseases according to Chinese medicine. This leads us to think about how we can treat it, because we need to reduce this sensation that the body is being attacked. And we have ways to do this with acupuncture. Machocha also tells us that the failure of the digestive system is primarily in the yin root of the essence, the marrow, and the kidneys. The yin root. You know that in Chinese medicine, we always talk about yin and yang. Yin is tranquility, yin is the way to cushion, and yang is movement, it is aggressiveness, it is going outward. Yin and yang must always be balanced. During the day, we are more yang. We get up, have a coffee, get moving, 2009, and we are always ready, or we should be, and we are always alert. And during the night, we are in a more yin situation. We rest, our body relaxes, in a way it resets, and we reintroduce yin energy into the body, resting to cushion that yin and yang. What generally happens in autoimmune diseases is that the yin that should cushion the body, that energy that should calm us, is not doing its job. And we always have this defensive system, almost ready to activate or even activating. It's as if we were always driving a car with the accelerator, pressed down, always with our foot on it, and it could always take off. This would be a bit of the explanation from Dr. Machocha about autoimmune diseases. And he also says that kidney insufficiency, kidney in the broad sense of the word kidney, because you know that in Chinese medicine, kidney is not just the kidney, it is a whole galaxy of systems surrounding the kidney. The kidney governs vitality, but the kidney also governs yin energy, the fluids of peace, the return to tranquility. Well, he says that kidney insufficiency is at the root of all autoimmune pathology. He also tells us that the pathology is very complex, but that we should not always place inflammation at the same level as heat. In Chinese medicine, we say that yang is heat, and therefore it would be very easy to say that autoimmune disease is an excess of heat. Well, yes, but it is a chronic disease. It is an insidious disease, and therefore it is probably not so much an excess of heat, but a deficiency of yin, or of that energy of tranquility that I mentioned, which makes us be in a situation as if it were heat, but it is actually a situation of deficiency. We will talk more about this now. And the etiology of autoimmune diseases is different from the etiology in conventional medicine.